I was diagnosed with a chronic condition called interstitial cystitis, which is broadly defined as pain, pressure, or discomfort in your bladder that exists for more than 6 weeks, so chronic in nature, that doesn't have any other identifiable cause. And I was diagnosed by a urologist, although it is important to note that it did take me a few years to be diagnosed. I did see multiple providers before I identified a urologist who knew about interstitial cystitis. Before I saw him, I had a sense that that was what I had, and I sought a consult from this particular provider, and within only about a few minutes, I was diagnosed with the condition. At this point, I seek care from a team of providers, so central to that team is my primary care provider or family physician. In addition to my primary care provider, I also seek care occasionally from a mental health counselor or therapist, because living with chronic pain can really take a toll, and seeking care from a mental health provider can really be very helpful. I also have a very understanding gynecologist. Because I do engage in physical activity as a way to manage my pain, I do have a coach who is an integral member of my care team, and I'm also looking into seeking care from a physical therapist, because they can really be central to helping folks who live with chronic pelvic pain in the management of that pain. As I think about the information that I wish I had known when I first was diagnosed and started treatment for this condition, I would say really it has to do with the guidelines from the American Urological Association. These were not really available back when I was diagnosed, and so folks who are diagnosed now or who are starting to manage the condition now are fortunate that we have this set of guidelines that are really based on the best evidence that we have to date about what is effective for treating this condition. So I wish I had known at the time that some of the first-line treatments really involve self-care and stress management. When I first started undergoing treatment for the condition, some of the first things that I did was jump to medications and some more invasive treatments like installations of medication directly into my bladder that weren't terribly effective. And I wish that I had known a little bit more about what we know now about what are effective treatments. If I had to explain my pain to others, I would probably describe it as waxing and waning. So it doesn't ever really truly go away. It just kind of ebbs and flows as far as the severity of the pain. I would also describe it specifically as urethral pain, primarily a burning sensation, or sometimes a more sharp or acute pain. And this is associated with, and I can sense this pain before, during, and after urination, but it's also associated with things like going through a pelvic exam or sexual intimacy as well. The most challenging aspect of living with interstitial cystitis, I would say, is one, just the general lack of understanding and awareness of the condition. So having to explain to someone that I have interstitial cystitis, it's not even a name that rolls off your tongue necessarily, but people have generally never heard of it, and it's never terribly comfortable to talk about bladder pain with someone. So that general lack of understanding, the fact that I look fine, I don't appear to have any sort of physical disability or issue, sometimes makes people a little skeptical. And also just the fact of living with chronic pain, something that, while sometimes it gets a little bit better, it never truly goes away. And so living with that and experiencing that on a regular basis, and some of the consequences of that pain with regard to being able to sleep, being able to concentrate at work, be productive, on intimacy with others, can certainly play a role. If I were to give advice to a newly diagnosed patient with interstitial cystitis, I would say a couple things. One, find a good team of providers, and really an emphasis on team. So not just one doctor, not just a urologist. A urologist can be helpful, but there are other folks who can assist you, including your primary care provider, maybe a gynecologist, a mental health counselor, and a physical therapist as well. They are definitely a part of some of those first-line treatments for the condition. They can be really helpful for folks who are living with chronic pelvic pain. So find a team. I think also make sure that you have good health literacy. So make sure that you're a good critical consumer of health information, because there are people out there who might want to take advantage of you and maybe offer you treatments that really aren't very evidence-based. So you want to be able to evaluate the health information out there in a skeptical and critical way. And so making sure that you have a good sense for how to evaluate health information, and also I would say considering the first-line treatments presented by the American Urological Association, considering engaging in self-care and stress management as initial strategies for coping with your pain. What I do to manage my pain now really revolves around stress management and self-care. So I engage in a lot of physical activity and exercise. That seems to be the most productive thing for me. But just general stress management, learning when to say no to things, when I need to take a break and engage in self-care is incredibly important for me in managing this condition. As far as resources that have helped me in this journey and in supporting my pain management, I would say hands down, without a doubt, the Interstitial Cystitis Association has been absolutely central to me being able to effectively live with this condition. They offer a wealth of resources, connections to support groups, to healthcare providers, opportunities to provide you with good information. So I talked about health literacy. They are a reputable source of information on this condition, so I would certainly suggest to anyone living with this condition to connect with the ICA.